Hi, good day. My name is Karen Grace Katigbak. Today, I will be demonstrating the process of range of motion. Range of motion is an exercise. It refers to activity aimed to improving movement of a specific joint. When passive range of motion is applied, the joint of an individual receiving exercises is completely relaxed while the outside force moves the body part, such as leg, arm, throughout the available range. The purpose of this range of motion is number 1, to increase muscle strength and endurance. Number 2, to maintain normal physiological function. Number 3, to prevent complications caused by immobility like contractures. Number 4, to improve physical activities. Number 5, to increase joint flexibility exercises. Remember, range of motion can be done 1 or twice a day. And next, we have to wash hands to avoid infection. After washing hands, we should identify the client in order to us to ensure that we are performing the right procedure to the right plan. Hi ma'am, my name is Karen Grace Katigbak, your caregiver for today. May I know your name and birthday, ma'am? Thank you, ma'am. So now that we have verified the information of a client, we also have to ensure the client's privacy. Remember, range of motion exercises can be done in a quiet place environment. Next, we should explain the procedure to the client in order to encourage the client's cooperation. Okay, ma'am? So now, I will be doing the range of motion exercises. Is that okay, ma'am?
Okay.
The following procedure that I will do preserves muscle tone and joints flexibility. First, on the neck part, we will do the flexion. Position your head as it looking at the toes. Next is extension. Position your head as it looking straight ahead. The next is hyperextension. Position your head as it looking at the ceiling. Next, lateral flexion. Move your head on the shoulder and then to the other. Next is lateral rotation. Move your head on a twisting motion from side to side. Again, flexion, extension, hyperextension, lateral flexion, and lateral rotation. Next, let us move on the shoulder part of the body. So for the flexion, we will do a flexion. Move the arm forwarded overhead. For the extension, move it back side of the body. For the vertical abduction, swing the arm out and up. For the vertical adduction, put it downwards to the body. For the internal rotation, move the arm up at across the body. extension, put it to the side of the body in the right angle. So again, flexion, extension, vertical abduction, vertical adduction. Internal rotation, external rotation. And do it to the other side. We will do the flexion by holding the elbow in the hand. And bend the arm. Then for the extension, straighten the arm. Again, flexion and extension. From the hand, I will do the supination, neutral, pronation. Supination, neutral, pronation. From the forearm, pronation, supination 180 degrees and pronation 90 degrees. Pronation, supination, pronation, supination. Now I'm gonna do the hand flexion. First is abduction, adduction, abduction, adduction, abduction, adduction. And now I'm gonna do the opposition to little flexion finger. Abduction, adduction, abduction, adduction. And then the extension, flexion. Flexion, extension, flexion, extension. Bend the knee for flexion. Then straighten the knee for extension and hyperextension. Flexion, extension, hyperextension. And then I will do the abduction, adduction, abduction, adduction. And then I will do an outward rotation, inward rotation, outward, inward. On the foot, I will do the dorsiflexion. Again, dorsiflexion. And now I'm done to the procedure. And I'm going to the procedural steps. Wash hands, make patient comfortable, and record the procedure.